Well, hello, my name is Dr. David Hartz, and I want to welcome you to a webinar on sugar handling problems. Are drugs the only way? This is brought to you by the North Florida Spine and Wellness Institute. And this problem is a growing problem that has really plagued the United States and throughout the world, and it truly is a plague. It is increasing at exponential rates, and we're seeing that literally millions and millions of people are becoming insulin resistant, as we're going to talk about in this webinar, and it's producing unbelievable amounts of suffering and pain as well as disease. See, the prevalence of diabetes in 2012 was 29.1 million Americans, or 9.3% of the population had diabetes. That's approximately 1.25 million children and adults have type 1 diabetes, and undiagnosed almost 29 million, and 21 million were diagnosed, and 8.1 million were undiagnosed. So there's a tremendous number of people who either have been diagnosed with some form of diabetes, are undiagnosed, and as we're going to find out, are pre-diabetic, which can be handled and be treated very, very well if people are aware of it and they understand how to do it. So you can see on this graph the rate of increase of diabetes is just exponential. It's going up at a rate that's just unbelievable, and this only goes through 2005, and it's escalated way past this in 2015. We can see on this slide that there's 70,000 deaths annually from diabetes. We see 1 out of every $5 spent on healthcare is spent on this disease. That's unbelievable. It's the 7th leading cause of death, almost $174 billion it costs just to diagnose diabetes in our healthcare system. There's 1 in 3 American adults will have diabetes by 2050. So that's 1/3. 1 out of every 3 people are going to be diabetic by 2050 if this is not handled and we don't get this under control. 2 out of 3 people with diabetes die from heart disease or stroke. So this is not just a disease that costs a lot of money or affects a lot of people. It is causing a tremendous amount of death and suffering. The new cases, some of the statistics are really startling because, see, in my dad's generation, we only saw diabetes as a senile diabetes, they used to call it, or late stage or late life diabetes, when we start talking about the difference between type 1 and type 2. And type 2 being just totally diet related and late stage. Now, as you can see, one of the fastest growing groups is the 45 to 64 year olds, and the groups of 20 to 44 having total, this is lifestyle related. We're doing this to ourselves, is increasing greater than the greater than 65, which we never even saw this disease until after age 65. So these two groups have grown unbelievably. Especially startling is the group between 20 and 44, and also the 45 to 64. And if we don't do something to stop this, it's going to continue to rise until, literally, 50% of the population is going to have this disease. You can see the prevalence of obesity and diabetes. There is certainly a strong correlation between obesity and diabetes, but as we can see from 1994 to 2010, this process of obesity is literally taking over America. And as the obesity occurs, also diabetes is also increasing exponentially. And we can see, I think, vividly by the colors on these charts, how this is literally taking over this country. And it's going to cause tremendous amounts of disease and suffering as well as cost. So how bad is it? The CDC fact sheet says that overall risk for death among people with diabetes is twice that of people without or similar age. So we're talking about doubling the chance for high blood pressure, heart disease, stroke, and blindness and kidney failure. Because it affects small blood vessels, and these small blood vessels can affect numerous parts of our body with inadequate blood flow increasing the complications of pregnancy and also nervous system impairments. So what is diabetes? Diabetes is a condition where the body fails to utilize the ingested glucose properly. This could be due to a lack of hormone insulin, or because the insulin that is available is not working effectively. And so therefore, the blood glucose continues to increase, and as that does that, we get into something called glucose toxicity and related insulin resistance, which we're going to talk about more. So we have really basically three big types of diabetes. We have gestational, which means during pregnancy, many times, not many times, but it does happen where the mother will end up having increased rates of blood glucose in the blood, or increased levels of blood glucose in the blood, and it goes over the gestational period of the child, and then once she has the baby, they drop once again. This usually is showing that the person has a tendency for later on stage diabetes, but it does resolve once the pregnancy is over. Then we have type 1, which we're going to talk about in a second, and then we have type 2, which is the most common type of diabetes. That's about 85% of all diabetes is type 2, which we're going to talk a lot about that tonight. Type 1 diabetes is basically autoimmune. It's been known mostly as adolescent or young children, young child or adolescent related diabetes, and the exact type and cause of diabetes they say is unknown. It's really an autoimmune disease, and it's basically the immune system coming after the body. We believe there is some strong tendencies to have, and there's some research that says that there can be some immune challenges. We call either viruses, fungus, even parasites, unicellular, that can affect this, as well as toxicity in the body that triggers off the immune system, causing the body to go after the different cells, the islets of Langerhans within the pancreas, which causes damage to them over a period of time and basically destroys the pancreas' ability to produce insulin. And many of these folks, if you don't catch it early enough and you don't get them in the storm, it's almost like an autoimmune storm against the thyroid when Hashimoto's or Graves' disease. If you don't catch it fast enough, it can do a lot of damage really quickly, and then you end up on diabetes related drugs like insulin the rest of your life. So insulin resistance is one of the biggest causes of the type 2 diabetes that we're going to talk about now. And insulin resistance occurs when your pancreas produces insulin, okay, and as your body receives large amounts of glucose through your diet in forms of sugars and refined carbohydrates and unrefined carbohydrates, they start to convert them into glucose, and when it hits your body will excrete insulin from the pancreas to cause the receptors on the cell walls of every one of your cells. You get like 43 trillion of these. What happens is the insulin needs a receptor to be able to get the glucose into your cell. You need one glucose molecule for every insulin molecule. And what happens is the receptor actually causes more increased permeability to the glucose. The insulin receptor does. So they're like these little gates that occur, and they have to be able to get the insulin into the receptor, causing the glucose to be able to get into the cell. And so what happens is when this insulin gets secreted over a long period of time, these receptors become dulled. It just overstimulates them. And it's like I say all the time, it's like screaming at a teenager. After a while, they don't listen to you anymore. They just get nulled to the noise, and that's what these receptors do. They just stop responding, okay? And before you know it, they become resistant, and we call that insulin resistant. And when that happens, these blood glucose, instead of being able to get into the cell, starts building up in the blood. And then all of a sudden, now we're measuring it, and we're seeing high levels of blood glucose. One of the really biggest problems we have is something called prediabetes, or early signs of this. The Centers for Disease Control and Prevention now estimates that 40% of Americans aged from 40 to 70 have diabetes, and nearly 2 out of 3 Americans over the age 65 are pre-diabetics, and most likely due to increased number of people who are overweight and active, and which boosts the diabetes risk. So what's happening is doctors are not diagnosing and treating pre-diabetics, And this is happening for a number of reasons. Also because they fail to order necessary screenings, or because the symptoms of prediabetics could be subtle, especially in early stages, and people not reporting the potential red flags to their doctors. So what's happening also is the diabetic ranges on blood tests. I mean, the functional levels that we think are important are between maybe 75 to 90, or 95 at the very most, 85 being a good level. Well, they don't even measure it as being abnormal until you get over 99 to 100. But if you have 110 glucose, you can have it forever, and they won't even do anything about it. But when you hit 120, now all of a sudden you're diabetic. Well, guess what? You're starting to become diabetic when you get over 90. You're starting to become insulin resistant. At 90 degrees, milligrams percent of glucose in your blood, you're starting to secrete enough insulin where you're starting to make those receptors basically resistant. And so the only way to be able to do something about this is to get it earlier before it causes all kinds of damage. I mean, there's all kinds. We're going to see down in just a few minutes here that there's all kinds of symptoms that can occur from these increased insulin levels, which can cause dementia and increase damage to numerous places in your body and brain before you even know you've gotten them. And in medicine, we're waiting for you to get very, very, very sick before anything's done, and by then it gets harder and harder to help. So hyperinsulinism is a high fasting insulin, is a condition in which there is excess levels of insulin circulating in the blood relative to glucose levels. While it's often mistaken for diabetes or hyperglycemia, hyperinsulinemia can result from a variety of metabolic diseases and conditions. While insulinemia is often seen in people with early stage 2 type 2 diabetes mellitus, mellitus, it's really that type 2 diabetes mellitus is actually the diet-related type 2 that we've been talking about. It's not the cause of the condition, but it's only one symptom of the disease. So high insulin can precede high blood glucose. And this is one thing that we look for. We do blood testing for high insulin along with all the other testing that we do. And this can give us inklings, very, very good inklings, because these insulin levels can go up before you become really super insulin resistant. And by changing it then, we can save people tremendous amounts of trouble. And once again, this is the transport process of the glucose causing those receptors to allow those insulin to be able to get the glucose inside the cell. These are some of the things that insulin resistance can cause. It can affect, this is why it's so serious, cardiac myopathy, neurological changes, frequent urinary frequency, lightheadedness, bloating, heartburn. These are many things that can happen before you even know you have any problems. They're telling you you're fine and you have all these symptoms and you can't figure out why you got them. Increase in abdominal fat. Around the belly, you start developing a ring of fat around your belly. Elevated blood sugar can happen with that. It may not even be, it may be just elevated, but not outside their normals yet. You know, normals, I mean, these elevated levels are so high by the time they do anything about it, people are in big trouble. Hypertension. A lot of people with hypertension have this, and that's what's driving their blood pressure up. Elevated triglycerides, inflammation of liver and cirrhosis. Sleep apnea, polycystic ovary disease, PCOS. Very common. Atherosclerosis contributes to heart attacks, strokes, peripheral vascular disease, increased blood clot risk, and low HDL or good cholesterol. People who would have thought that, you know, this insulin resistance could drive down your good cholesterol levels. You know how they treat that? They give you, you know, a statin drug. Okay, you know what statin drugs do? They increase the chance of diabetes. So it's this vicious cycle you get on where we're not treating the cause of the problem once again. We're treating the symptom, and we're not getting to the cause. And one thing has a tendency to cause the other problem to get worse. So signs of high insulin. Once again, we just talked about that. There's several different other ones on here. The ones that aren't on the other slide that I wanted to be able to point out was hunger and craving for sugar and carbohydrate-rich foods. This happens after you eat. A lot of times, people that are insulin resistant will start to get a sugar craving or a sweet tooth. You know, so I get a sweet tooth. No, what you are is you're dumping a bunch of insulin, and it's causing you to want to go get some sugar to be able to utilize that insulin that's in your body, and you're becoming insulin resistant. If you really can fight that tendency and be able to lower the carbs after a while, you won't get that sugar craving so much, and you can stop this. We have ways to be able to help people with that, to help decrease those cravings and so forth. But yes, that can do it. Also, acne, large pores on the face. People never think about this being that. Scalp hair loss in women in the male pattern. Skin tags, these little tags of skin that start popping up on people all over the place. Many times this is related to high insulin levels. Increased risk of gout. We talked about blood pressure, and then swollen ankles. Insulin can sometimes affect your kidneys, cause you to retain sodium and certain minerals and electrolytes, and therefore you look more puffy. Your face can get puffy. Your eyes, underneath your eyes, can get puffy. You can start getting a little more puffiness in your ankles. These are all can be early signs of which they just give symptomatic drugs for this. They're not going to try to figure out what's causing it. That's my concern. So type 2, full-blown type 2 diabetes symptoms: blurred sight, increased sensation of numbness, itchy dry skin, frequent urination, increased thirst, tiredness, weight loss, vaginal infections, always hungry, sexual dysfunctions, ED, erectile dysfunction, loss of libido, testosterone problems can be related to this also. So this is full-blown diabetes. This is when your blood glucose is over 120 and it stays there consistently, okay? Now, so let's talk about conventional causes, the basic medical causes, the standardized medical causes of why they say diabetes exists. And it's usually three major things. It's diets, it's genetics, and it's obesity. And diet certainly, and every one of these things contribute to it. There's absolutely no doubt about that. That diet certainly can affect it, and it's one of the things we use to help it tremendously. Genetics can be affected. But listen, we throw a lot of things into genetics when we don't understand it in standardized medicine. If we can't figure out a cause, and it's always genetic. You just got this, it's just in your genes. Well, guess what? There's some studies that have been done that show that what's in our genome, what we're given from mom and dad, sometimes only affect less than 3% of what we end up getting. It's really what genes are turned on, what actually manifests that we have to worry about, not what the potential for disease is. And certainly obesity contribute to this. A lot of times we say it's obesity, but, think skinny people don't get diabetes. Think again, because it happens all the time. It's not always just heavy people that get this disease. This happens to thin people too. Insulin resistance is not always because of obesity. It certainly can be contributed to, and it's certainly a problem, but not always. So let's talk about some functional causes now. Some alternative causes, getting down to actually trying to figure out why the body is dysfunctioning. That's the difference between functional medicine and conventional medicine, is that conventional medicine just takes a symptom and tries to create a pharmacology to control that symptom, whereas in functional medicine, we try to, what is the functional problem here? What's not functioning correctly? The body really wants to be healthy, and if your blood glucose is going up, instead of, I'm going to show you some of these drugs that they use to treat this. It's just kind of amazing. Instead of just trying to treat it symptomatically, let's try to actually get the body better and let it handle this blood glucose correctly. So the first one we want to talk about that you may have never heard of or even thought of had anything to do with diabetes, and there are these four different things here I want to talk about, because this is very important, because these things are not being addressed, and they're contributing to this plague which is increasing across our land. The first one is toxicity. Toxic burden each year in our air, food, and water, and thus over our bodies, grows higher than ever before. Companies manufacturing 6.5 trillion pounds of 9,000 different chemicals each year. Just think about that. That's about 3.25 billion tons, enough to fill an ocean liner super tanker. I mean, this is a gigantic amount of stuff. And the same companies release over 7 billion pounds of 650 different type of pollutants into our atmosphere and water every single year. We wonder why we have a problem. It is increasing absolutely exponentially. And as I say all the time, if I could color everything purple that was toxic in our environment, we'd be freaked out, because we'd be seeing purple around us all day long. It would be in the air, it would be in the water, it would be in what we're eating, it would be in our sandwiches, it'll be in our food, it'll be in everything in our environment, and in the cosmetics, the creams, the air fresheners, everything in our environment just has so much toxin in it, and it's increasing like crazy. And our body is absorbing these things. We know for sure from multiple studies that these chemicals are increasing in us. Now, let's talk about this toxicity and diabetes. What does it have to do with diabetes? Well, we have several different research papers. A couple of them I'm just going to mention here, that shows for sure that these particular substances, and we're going to use arsenic for example here, several studies suggest that the association exists between arsenic exposure and an increased risk of diabetes. There's a potential relationship between mortality from diabetes and chronic arsenic exposure. An indication of relationship between arsenic exposure and diabetes have been also reported in studies of copper smelters and art glass workers. So we know for sure that these heavy metals that come into the body can affect the pancreas, and it can affect blood sugar levels ultimately. And so therefore toxins in us, which nobody's addressing, they're trying to drive down or just let the glucose leak out of your kidneys or drive it down by stimulating your body to produce more insulin, but they're not trying to get to what originally caused your body to go haywire. And they're basically trying to patch you, the bottom line. Let me show you this one. Persistent organic pollution exposure leads to insulin resistance. These are toxic, different exposures of persistent organic pollutants, which some can be organic pesticides and different things in our environment. The conclusion was our findings provided evidence that exposure to POPSs, commonly present in food chain, leads to insulin resistance and associated metabolic disorders. So there's no doubt about that environmental exposure to this stuff, in this case organic pollutants, definitely increase the insulin resistance and associated metabolic disorders relating to it. And so this has to be addressed. If we want to get to this, just taking a pill to lower your blood glucose is not going to cut it. Environmental health perspective also shows, there's another one. I'm just going to show you a few of them. The conclusion on this was really unbelievable. The conclusion overall, the review of existing literature identified linkages between several of the environment exposures and type 2 diabetes. This was a meta-study that took multiple different studies and looked at a bunch of them and came up with the conclusion, yes, these environmental exposures, to arsenic and persistent organic pollutants, maternal smoke, nicotine, organotins, phthalates, the bisphenol A, and the pesticides, and high throughout screen. I mean, all throughout our whole society, and we see this toxic exposure increasing, and it's affecting our ability to be not insulin resistant. So once again, toxins are a big issue. And what's really amazing is, just to show this one little graph, in 1970, this is the amount of lead in 1 deciliter of blood, 60, that was considered dangerous. Now it's all the way down to less than 5. And so nowadays they're saying, oh well, this stuff is not dangerous as far as diabetes is concerned. And 10 years from now, all these levels that they say are going to be totally normal now are going to be all abnormal, because as time goes on, they find out that just how dangerous this stuff is. In fact, I found one research paper that said the smaller the amount of the toxicity, the more danger it was, because of the way it affected the overall metabolic processes in the body. And so doesn't have to be a whole lot, and we sure got a bunch of it in our environment, and it's hitting you and me each and every single day. Let's talk about immune challenges real quick. What these immune challenges are bugs. Okay, they're virus, bacteria, fungus, and parasites. And we think in our bodies most of the time that we have to have really bad infections. Well, there's 2 types of infections in the body. There's acute infection, which is the sinus, the kidney infection, the bladder infection, the really severe infections, the pneumonia that we know is really severe, the flus and so forth like that. Everybody knows those. They're easy to find, really. They're really easy to diagnose. The blood tests are really off the chart. They're not hard to find. The really challenging one is what we call chronic infections. These are virus, bacteria, fungus, parasites that get into the body. They don't make you deathly sick, but you never get over them. They just sit in your system, wearing away. A little bit like shingles and different types of bugs like that we know. Or herpes simplex or herpes types viruses, where you get cold sores popping up in your mouth periodically. You get run down, and all of a sudden they'll pop up. Those are things that are in your system, just sitting in there, not ever getting better totally, but not ever really knocking you totally out. Well, those can cause additional problems as far as this diabetes. We see bacteria as an example here. In this study, a new study in the University of Iowa biologists now suggest that bacteria may even be the cause of one of the most prevalent diseases in our times, type 2 diabetes. So we're finding out that this chronic infections can actually affect the pancreas and also excrete exotoxins that can affect at the cellular level. And so this is something that nobody looks for. Nobody looks for chronic infections in the body as a cause or contributing to diabetes. And there is folks that, and not small numbers, that are being affected by this. Next one's autoimmune. Now, autoimmune basically is when the body, the normal defenses of the body, which are absolutely necessary, actually don't fight just bad guys, but they turn against the host, the person, the you and me's. In other words, our body starts coming after ourselves. And this is what we call autoimmune. And what happens is the body starts producing antibodies that actually go after the pancreas itself. Now, this is known very well in type 1 diabetes. They've kind of accepted, as I mentioned earlier, that this is the cause of that. But now they're starting to realize that this type 2, which they thought was totally diet related, which certainly is contributed to it by that, also has an autoimmune factor involved. As we can see, these results are strikingly similar to the number of prospective studies carried out in childhood diabetes. If the islet cell's autoimmunity is truly presented in 10 to 15 subjects clinically diagnosed with type 2 diabetes mellitus, up to 2 million Americans might have unidentified autoimmune forms of type 2 diabetes mellitus. So we know that maybe millions of people could be suffering from an autoimmune effect upon the pancreas and not just totally diet related. The diet would be important, but there's other factors, just like in the toxicity and so forth, and in immune challenges. So autoimmunity can be effective in many of these different problems. Viruses, vitamin D can all be associated between autoimmunity and this. Less breastfeeding, complicated births, high BMI, stress. All these chemicals can set off your body to start producing antibodies against itself. We see metals, pesticides, dioxins. These are all toxins in here. The phthalates, the solvents, and even UV radiation can do this. Okay, so there's tremendous number of things like gut microbial, the microbiota, and viruses. These are all immune challenges. These are all things we work with all the time, trying to determine and to help the body get over them. We detox these. We help the body fight these. We take these out of your diet, and we affect every one of these. And it's really amazing when we start getting to some underlying causes that people aren't addressing, just how much better people get. Last one is inflammation. Inflammation can also be tracked down as a major cause of chronic disease. We see in Time magazine they had a big front cover on this because it is a surprising link between inflammation and heart attacks, cancers. It affects a large number of different conditions. We see a cell, it has a cell membrane. We see these receptors we just talked about on the cell membrane. It's a bilipid layer. It's got two lipids layers that are affecting whether or not these receptors allow things in. And there can be all kinds of receptors on the cells, and not just ones for insulin. We're talking about diabetes now, but this can be thyroid hormone. This can be female hormones. This can be testosterone for men. It can be leptin, which affects your ability to increase your metabolism and decrease your appetite. So if this leptin cannot get in these cells, you'll be real hungry and you won't lose any weight. So this cell inflammation that occurs on the cell walls affects numerous different metabolic processes in our body, and it certainly can affect our ability to utilize glucose and affect our ability to have normal sugar regulation. So inflammation from toxicity and bad ingestion of like oils, instead of having saturated really good oils that are very healthy for you, you do trans fats and hydrogenated oils, and when they get into these cell membranes, they cause tremendous damage to these receptors. And this is one of the most powerful areas of research that's going on right now, is these receptors. And unfortunately, they're being studied a lot just to make a bunch of drugs to treat people symptomatically instead of trying to actually correct the normal physiology, which is kind of what we work on. And here's the selective transfer that occurs through this bilipid layer I just mentioned. And here's some of the things that can happen from it. We've got diabetes, as you can see on here. Cancer, though, cardiovascular disease, Alzheimer's, pulmonary disease, arthritis, autoimmune, and neurological diseases. All stems from this thing called inflammation. So these are things that just standardized medications for the drugs are not handling. They're not going after this. They're just trying to leak out, either increase the utilization by decreasing insulin resistance, which is good, but just chemically doing it, but not getting to the cause, just forcing these gates open so more glucose goes through, or in some cases, I'm going to show you, just causing these drugs to leak out. Drugs just to cause the glucose to leak out of the kidneys. This is just showing that modern lifestyle can cause inflammation, also genetic predisposition, obesity, leptin resistance, we mentioned leptin, impaired glucose metabolism, and it all ends up, this inflammation can end up the beta cell, which is the cells inside the pancreas making the insulin, and cause destruction, and then also the impaired glucose metabolism can cause insulin resistance. They all end up causing type 2 diabetes. So there's a couple different paths there, but they all end up the same place. Let's talk about conventional drugs just a little bit here, because this is certainly how 95% of all diabetes is treated with just conventional medicine. It's usually done by drugs and then a minimal amount of nutritional counseling. I mean, it's like, don't eat the carbs, stay away from them. Nobody helps people break the cycles. They don't give any people diets in many cases. It's just basically live on the drugs, stay away from it if you'd like. If you don't stay away from it, we'll just give you more drugs. And what that's causing is some major problems. And this is one of the reasons right here. This was a meta-study that I found that was just really amazing, in that they took 13 different studies. A meta-study is going and trying to find multiple studies and getting some generalized impressions of if there's any commonalities in all those studies, and then making conclusions from that. This was a real starting conclusion. They basically came to the conclusion that the effect of intense glucose-lowering treatment, that's taking drugs for your diabetes, on all-cause mortality, cardiovascular death, and microvascular events in type 2 diabetes, the meta-analysis randomized controlled trials, the results were this. When you're taking these drugs just to decrease glucose, what they're trying to say to you is if you take these drugs and lower your blood glucose, you won't get all these problems of diabetes because we've just lowered your blood glucose. Okay, and what this meta-study is saying is this: intensive treatment was not associated with significant risk reduction, but resulted in a 47% increase in risk of congestive heart failure. So in other words, there was some improvement of a few things, but in general, the people that took the drugs only and didn't handle all those other 4 factors that I told you about were not alleviating or not having some of the most severe symptoms which occurs from type 2 diabetes, because in many cases the insulin's not being handled, and we're not getting to those underlying causes, the autoimmune, the different instances, the toxicities and so forth that we were talking about that were causing these different problems, and therefore the underlying problems kept right on getting worse. And so therefore it's a misnomer to tell people that just because they're taking a insulin resistant type of glucophage or a metformin or some of these other drugs that we're going to be talking about is actually handling the whole problem. The meta-study says that's not the truth. Let's look at some of these conventional treatments just for a second. We're almost done. Metformin slows down production of glucose from the liver. So it just basically goes down and just keeps your liver from producing. It also increases a little bit of, decreases insulin resistance somewhat, but it mostly slows down production from your liver. Avandia acts primarily by increasing insulin sensitivity. Geneva stimulates pancreas to make insulin. Infocana increases glomerular filtration from the kidneys. But let's look at a couple of these side effects from this. Common side effects of metformin: acute infections of the nose, throat, and sinus, diarrhea, feeling like throwing up, gas, head pain, inadequate vitamin B12. It actually inhibits vitamin B12 absorption, and you end up with vitamin B12 deficiencies. Get stomach cramps, swelling of the abdomen, taste problems, and also, once again, feel like throwing up again. So there's a whole lot of side effects. Not all of these happen in everybody, but they can happen in varying degrees and do in a lot of people. And a lot of times people have no idea that they can cause other problems like B12 deficiency. Less frequent, you can see, is trouble breathing, chills, dizziness, excessive sweating. I put all these on here because you may have some of those and you may not even know they're coming from the drug if you're taking metformin. Heart throbbing, and complete and frequent bowel movements, indigestion, inflammation of the nose, rashes, temporary redness of the face and neck. These all can be from metformin. Avandia, this is amazing because they put this drug, and it's still on the market today, is the poster child for what is wrong with the drug treatment of type 2 diabetes. After hitting the mark in 1999, a 2007 study in the New England Journal of Medicine linked it to 43% increase in the risk of heart attack and a 64% increase in risk of cardiovascular death compared to previous treated other methods. Guess what? Still on the market, still being given people. It increases the chance of cardiac death by almost 64%. Absolutely amazing. People are still prescribing this. And people have no idea that, I mean, yeah, it lowers your blood glucose, but you die of a heart attack. I mean, that's really great. Another conventional, we have Invokana. It decreases glomerular filtration rate in the kidney. This is still being advertised on the TV right now, and attorneys are starting to go after all of this. It includes side effects of the kidney damage and myocardial infarction, which is heart attack. And so it increases that chance by up into the 46 to 50% rate of increased chance of heart attack by taking this drug. It basically just causes your kidneys to leak the glucose out into your urine. It doesn't get to why the glucose is too high. It doesn't get to the insulin resistance. It doesn't get to the diet. It doesn't do anything. And so by just, the idea is just getting the glucose out of you, you've solved the problem. It's not that simple. Just getting the glucose out only gets the glucose out. Insulin, also in many forms, increase insulin resistance. Insulin has a tendency not to work over a long period of time. You become more and more insulin resistant as you dump more insulin into your body. And so what happens is you just get more resistant, and you have to increase more and more and more. And as you do that, you get more and more side effects of the insulin, which can be dementia and kidney damage and retinal problems in the eyes, and it just goes kind of on and on. It's a vicious cycle to get into. So let's talk about natural treatment. There's 4 factors. These 4 factors we talked about. What do? We detox the chemicals and heavy metals. We set out specific programs for individual people for, I mean, you can give a Corolla or try to detox somebody for mercury and have to give 4 or 5 different things to 4 or 5 different people to get the mercury out. In other words, it comes out differently for different people, and it has to be designed exactly for them. And that's why what we do design clinical nutrition, because it has to be designed specifically for the individual patient. But we work on getting those out of the body, and we do a lot of that. We decrease immune challenge by increasing natural antimicrobials and also increasing the immune system so that we start knocking some of these microbial counts down. We attack and eliminate food intolerances, and we eliminate those from your diet. We get nutrient deficiencies, and then we use clinical nutrients and to optimize blood sugar and insulin handling. And we individualize weekly nutritional, educational, and counseling. So we do weekly educational counseling and have you write down everything you eat, and we go through and help you, and we coach you, and we encourage you, and we give you alternatives, and we tell you what to shop for. Nobody wants to do this stuff, especially for the amount that we charge for it. And that's why it's not ever done. Nobody wants to take the time to help people get better. We actually enjoy it, and so we do it. But it's very important, and it's not being done. And without that, people just are going to basically take a drug to give them side effects and just drop their blood glucose. So this is the difference here. This is trying to just treat the symptoms up here. This is the symptoms, and these are the underlying causes. And these are some of the things we've talked about, all the toxic emotions. We've been talking about emotions, we've talked about chemicals and imbalances and so forth. These things can affect it. We have to get down underneath to figure this out. And when we do, people get much, much better. They get healthy, not just controlled with a chemical patch. There's some things that you can look for to try to help a little bit on your own. Chromium picolate, cinnamon, fish oils, alpha-lipoic acid, fiber powder, supplements. The problem with these is trying to match these up with individual people. Not everybody needs or responds to chromium picolate. Cinnamon doesn't work for every single person. It does help in general, and it's certainly a good thing to do. But we find when we can actually analyze each individual person and find a specific design clinical program for them, it works so much better. We get so much better results. But these are some things that you can look at that will help some, for sure. When we do workups on people, this is the difference between what we talked about. There's a difference between functional and pathological. Most blood tests just look for way large normals like this. And it can be gigantic. If you're sitting right here, as we can see in a second, you're not abnormal here, but you're definitely abnormal when we look at you functionally. And so we narrow the ranges in, and the functional range ends up being here, and these are functionally low and high, whereas you have to wait till you get all the way down in this area. And when you get down here and you stay down here for long enough, you're already doing a tremendous amount of damage to the body. So we narrow the normals down. We call them functional ranges. So what do we do? How do we treat people in the office? What do we do that's different? Well, we do a design clinical nutrition evaluation. We do a 26-page comprehensive timeline history. I mean, we go back all the way to birth, and we look for causes that can be causing you to have ill health. We go deep into your history, all the way back into birth, and we do a timeline consultation from there on up. It's amazing what we find about the body, and we find little hints and trails of how people have lost their health and what got them there. We do a heart variability test. Heart rate variability test is a fantastic test to actually measure the balance of the autonomic nervous system, the sympathetic parasympathetic system. It's used all over the world. It's a very cool test. It gives unbelievable. It can actually predict the chances of chronic disease, and it was developed originally in Russia. And we do that as part of our evaluation. Body mass index, we do a postural blood test and postural blood pressure analysis to see when your blood pressure drops when you stand up. It tells us a lot about different parts of your body. We do a medioxy urine test, which actually tells us about free radical excretion and formation in the body, which can certainly affect cell inflammation. Temperature of extremities, oral zinc test, complete neurosystem kinesiological biofeedback exam that works on biophoton physics, which we've gotten from a world-renowned expert on chronic disease from Germany, a medical doctor that developed this system, and we're actually certified in his institute and in his technique, and I think there's only a couple of us in the state of Florida actually, but and we use this in combination with the functional blood analysis, and we put this whole system together, and it really works well. Gives us really unique look at the body we can't get anywhere else. We can't even get from the blood some of the information we get from this. In fact, I don't think there's some of this I know for sure. There's no other way to get it anywhere else in the world of medicine to get this information. So we really enjoy that process because of the uniqueness of it. And a comprehensive report of findings and recommendations for care, where we sit down and take about 20 minutes and explain all this. Of course, the functional blood testing, and there's a blood sugar dysfunction panel. Whoops, the panel is actually spelled wrong there. But functional panel that tells us a lot about what's going on in your body, and it's very specific. We have the insulin levels we're going to measure and several other different parameters in there that is not done. And this was what happened at our seminar. I don't think that's actually available at this point, but our costs are really only about $100 to $120 to evaluate. Our blood tests are very inexpensive. They're almost 85% discounted, and because we make like 2% or something on our blood tests. That's just try to cover a little bit of the cost of our running it through our software in our office, but it's amazingly cheap. I can get a whole evaluation on somebody for $70. It's almost $450, $500 worth of blood works for $70. So we do that so that people can just make this affordable for them. We're on a goal to try to get some people healthy. And so if you are having issues with this particular problem, we're located in Tallahassee, Florida. It's North Florida Spine and Wellness Institute. We have people come from all over the world, and we counsel people from all over the United States to try to get them healthy. And we're looking forward to try to help you with any concerns you have and any problems that you may have in this area. And whatever you do, just don't settle for taking a drug and not trying to get to these causes, because there are other things that can be done. And Optimum Health naturally is available if you're willing to seek it out and to do things no one else is willing to do. I was saying, if you want to have health that no one else has, you have to be willing to do things no one else is willing to do. And so if we can be of help for you, please give us a call. Come in for a consultation. There's never any charge for a consultation, just to see if we can help you. And hope this has been helpful to you. God bless.